So today we are going to talk about two very important satellite centers in a hospital. Now what are satellite centers? These are smaller units of some important function which are done in a separate building or a separate facility. And these two are very important from the infection control point of view. So today we are going to discuss the ART center and the DOTS or the DOT center. First, let's look at the ARTS center. What is the full form of a ARTS center? Full form of the ARTS center is an anti-retroviral therapy center. And what is the main objective of a ART center? Now they have a lot of functions to perform. So they have to register and provide care and support and treatment services to PL-HIV and monitor patients in HIV care. What are PL-HIV? People living with HIV infection. So all the people who have HIV have to be taken care of in a ART center. They also have to identify eligible PL-HIV people. How do they identify? By doing a small HIV test. Now that can be done A, during blood transfusion process, B, by chance, C, when the doctor recommends that there might be some chances of you having HIV infection. And otherwise people also voluntarily go and get their HIV test done. So it's a duty of these people at the ARTS center to identify the people living with HIV infection. Then there is another important function is to disperse the drugs to the PL-HIV patients. Then they have to provide the treatment and counseling. For a HIV patient, more than treatment, counseling is required because they are living with a disease which sometimes takes their life to a terminal stage. So we have to make sure that a proper healing environment kind of counseling services center is given at the ARTS center. Then we have to counsel and educate the family members. So there has to be adequate provision in the ARTS center for the family members, friends and other people who are taking care of the patient. Then this is a place where the reference is given. Now what is a reference in a hospital? When you come to a smaller hospital or a hospital lower in the hierarchy, you have to refer your patient to a higher facility. That reference is also done at the ARTS center. Then very important, this is the nodal point for positive prevention. What is positive prevention? Where awareness is spread, education is given, important contraceptive methods are also distributed here at the ARTS centers. And a very important function is integration of HIV care into the general health system sustainably. What does that mean? It has to be made part of syllabuses, awareness has to be done, people have to be told about this whole HIV issue and how to deal with HIV patients and HIV issue. Now, as architects, as planners, as facility managers, as hospital administrators, we must understand how to design a good ARTS center. Now, while designing, one of the most important things is to locate the ARTS center at a proper position in the hospital site. So it has to be located ideally near the medicine OPD. Now, if that is not feasible, it should be identified, so that cross referral can happen. It should not be too isolated, yet it should not be too near other areas like the DOT center. Why? We will tell you while we go forward in this PPT or in this module, but most important is that there is a high risk of infection to the people who are suffering from HIV infection. So there also has to be proper signages depicting where the ARTS center is. And all the ARTS centers should have the logo "We care for you." That will be a very positive reinforcement for the patients because they are suffering from a disease which takes them to the terminal end of their life. So they have to be constantly reminded that we care for you, ARTS center cares for them, hospital cares for them, and the whole community as a whole cares for them. Now, the sample floor plan, you'll be shown the sample floor plan and also be given in the reference material that will be provided. But each room in the ARTS center should be at least 10 feet by 10 feet. Now, we look at what are the other rooms that are required in the ARTS center. We need an examination room, a counseling room, a pharmacy, a laboratory. Waiting areas have to be given. Waiting areas are very crucial, not only from architectural point of view, but also from the infection control point of view. In a waiting area, a person who has come for the first time to a ARTS center, that person is highly vulnerable to catching an infection from other patients. So we have to be really careful in designing very airy, naturally ventilated, infection-free waiting areas. And we also have to provide as architects entertainment facilities, television provisions and other things so that education can be provided while a patient is waiting. So patient is very panicky. He has to be provided education while he is sitting in the waiting hall. Then adequate space should be given, not only for this waiting areas, but also human needs like toilets have to be given, drinking water has to be provided. And we have to make sure that there is very high level of cleanliness and hygiene in this total ARTS center, which can, as architects, we can give by giving proper water points, proper janitor rooms. All that we have to think apart from the basic rooms that we have to provide. Now let's look at the furniture requirements. As architects, we also have to take care of the furniture requirements. So table chairs have to be provided, examination table with side screens, pillows and rubber sheet etc. should be provided. Office shelves should be there, appropriate furniture for computer and printer and office stationery should be there, secured cupboards for storing patient records. HIV, AIDS is a taboo subject in India. Medical records of patients should be in secured almirahs. That has to be taken into consideration while designing. Waste disposal systems should be proper and it should be properly designed. Proper number of dustbins should be provided and there should be adequate entrance exit point for waste removal in a ARTS center. So we have to look at the signages in the ARTS center. So proper display of the following things. What are the following things? ARTS logo, we care for you, has to be provided. Timings of ART has to be given. The list of facilities has to be given. What is near the ARTS center has to be provided. Then information, which gives an education to the patient while he is in the ARTS should be provided at all the areas in the ARTS center. Then there should be proper signages, proper monitoring systems ki who has to go next into the OPD. For that, proper LCD screens have to be provided. That all is the responsibility of an architect, planner, hospital administrator to give adequate arrangement for that. Now we are going to talk about a very important issue, and that is of signages in a ARTS center. Now what all signages have to be provided in a ART center? Number one, most important, ART logo, that we care for you has to be provided in the ARTS center. All the staff that is there, their name, designation has to be provided in a separate signage. Timings, list of holidays in bold language and in bold letters and in local languages has to be provided. List of facilities near the ART centers and a list of other ART centers nearby and basic information so that the patient, while he is waiting at a waiting hall, can read what are the basic symptoms, what is the basic prevention, what is the everyday care that he has to take care in his lifestyle so that he can have a better life while he is suffering from the ailment. Then we have to have other things like what are the government programs, this, that and so on. So we have to take care that we have to have all the important government programs related to HIV from the NACO or the National AIDS Control Organization, which have to be displayed as a signage in the ARTS center. From an environmental control point of view, we have to look at a lot of factors to have proper airborne infection control in an ARTS center. And we can do that by isolating the ART centers from dot centers. What are dot centers? Dot centers are where TB patients come. TB means tuberculosis. So we have to keep them away from chest clinics, microscopy centers, dot centers. There should not be shared ventilated areas at all. Now the place where the people are waiting, that is the waiting hall, should be very well ventilated. It should ideally be open outside and should be roofed additionally. It should not be covered all the four sides with walls. It should have open walls and just a roof to prevent from rain and sun. Now there has to be adherence to ventilation standards for airborne infection control, that is greater than 15 air changes per hour. There should be ensured in everywhere in the ARTS center. And when natural ventilation is of a concern, if we cannot give natural ventilation properly in a ARTS center, then we have to make sure we design proper mechanical ventilation systems, and that can be done by using filters. Number two, by having air changes, fresh air changes within the mechanical ventilation systems. That can be one way of having proper airborne infection control in the spaces. Now we look at a very important area, satellite area of a hospital called a dot center. What is the full form of DOTS? The full form of DOTS is directly observed treatment. It is for tuberculosis. Now, what do you mean by directly observed? It means that in community where people have tuberculosis, there is a very high risk of antibiotic resistance. So what people do, otherwise the medicine has to be taken for 6 months. What people do, they eat it for 2 months and then they start feeling good and they stop eating the medicine. So to make sure that the complete course of antibiotic is given, it was mandated that the patients will go to a dot center. There in front of a health worker, they are going to take the medicine and the health worker is going to give them the medicine, put a tick on his card, and then it is a directly observed treatment. We cannot rely on the patient that he'll go home and take the medicine, because the symptoms will go after 1 or 2 months, but the medicine has to go for 6 months to completely eradicate TB from the body and eventually from the community. Now, this design of dot center is very crucial. It should be your model space for hospital airborne infection control. It should be the highly infection free, zero airborne infection zone of a hospital. Now, what is the dot center in the TB hierarchy? Where is it located? So there is a state TB cell, then there is a district TB center, then there is a tuberculosis unit, then there is a microscopy center, and then comes the dot center. For example, in Delhi, I'll give you an example. In Delhi, there are 5 institutes, 25 chest clinics, and 200 dots and microscopy centers combined. Now there are 200 dot centers opened by the government, opened by voluntary organizations, where basically it is a small room at some areas and bigger spaces in other areas. But we will give you the very important requirements for little big areas in a dot center. So what are the functional requirements? We need a waiting hall, we need a reception, we need a consultation room, we need a sputum collection room, we need a laboratory, and that should be ideally with good biosafety standards. Biosafety standard 3 is an ideal benchmark for biosafety in labs. Then there should be a DOTS medicine dispensation room, there should be an X-ray room, there should be a blood sample collection room, and very important, a place where the community awareness is spread. Now what is a sputum collection room? So for people who have tuberculosis, they have to give sample of their sputum. Now this should be not a part of the main building. As an example, a very big TB hospital in Delhi has a sputum collection center away from the main building. We'll give you as part of the reference material, and there should be dedicated sputum collection, and there should be free from any barrier. It should be a shed like building. Top should be covered to prevent from rain and sun, but all the four sides should have no walls and it should be completely open. Now, a variety of simple to complex environment controls can be used to reduce the number of airborne infection in the work environments in a hospital, especially in a dot center. The simplest and the least expensive technique is to remove and dilute the air from the TB patient areas from patients without TB by maximizing natural ventilation through open windows. Very simple, traditional method. Just have proper windows. There are more complex and costly methods also, like using mechanical ventilations with window fans, exhaust ventilation. Isolation rooms are given negative pressures, and contaminated air is prevented from escaping into the hallways and other surrounding areas. There are other ways like air filtration and UVGI, ultraviolet germicidal irradiation. This is used to kill the M. tuberculosis infection, and this is usually done at the upper level of the room. Now, a TB center, you can put a UV light that has to be put at a upper level, but we also have to make sure that there is no direct exposure for a long time by humans of this UV light, because that can cause skin problems in humans. Now we have to take care of the waiting hall design in a dot center. This waiting hall has to be 100% naturally ventilated, and the space for sputum disposal. Now these people are constantly coughing, so they have to be provided with a proper wash basin at some well ventilated point within the waiting hall, and they should not be designed with rooms on all the four sides. It should not be like a courtyard design. It should be one side rooms, and then all the three sides should be open and should be properly 100% naturally ventilated. And though this is underestimated, the waiting halls are one of the high risk areas in a hospital. So we'll give you a small example. This is a small graphic. On one side is a waiting hall which is part like an aisle. Aisle means both the sides are rooms, and all the rooms open at the center aisle, and that is the waiting hall. Now that is a very bad design, because what is happening, there is no air changes happening in this kind of an arrangement. On the other hand, if we have a waiting hall which is open from three sides and has rooms on only one side as shown in the graphic, you will realize that here there is a higher air changes per hour, and there is natural ventilation, so there is high dilutional ventilation here, and there will be more release of the infection away from the patients into the open air. So we have to be very careful when making a design decision. So we have have just covered the ARTS centers and the DOT centers. The importance of ARTS centers and DOT centers is from a airborne infection control point of view. And these centers, even though they are part of hospitals, they are also built as standalone units throughout the country. Every district, every smaller village sometimes has a DOT center or a HIV ARTS center. So for these small places, we should not stick to whatever infrastructure we have. As good architects, good facility managers, good hospital administrators, good engineers, we have to intervene and make sure that we are able to provide the right interventions for ARTS centers and DOT centers, so that there is minimal risk of airborne infection in these areas. Thank you. Jai Hind.